The trouble is, of course, that every clinician will see different things in exactly the same situation. For example, some people will be allowed to stay in hospital when there isn't evidence that there's actually something going on which is treatable, and others will move people out very quickly. I was chatting to a nurse last night in an acute admission unit. On my way down here, actually, I stopped off in the middle of the country on the way down here and had a couple of hours with these nurses. And they were talking about one patient who was out of area, that had self-harmed superficially, came onto the unit, and he actually said, the patient actually said, if you try to discharge me, I'll kick off, or I'll harm myself. And the very acerbic, very robust consultant actually wrote in the notes exactly what the patient had said, but said this isn't the expression of mental illness. The patient may kill themselves, but if they do, it's not because of a treatable mental illness. And actually then wrote, under no circumstances to be readmitted in this area. And a letter went back to this patient's own area, and out the patient went. Now, I'm not describing that as a vision of best practice. I think possibly that there are shades of grey that he didn't address, perhaps a little bit like the famous journalist Gilligan. Perhaps this doctor was painting in primary colours as well. But nonetheless, a different clinician would probably have reacted in a very different way. And that patient, under a different consultant, may well have ended up on the ward for a long period of time. So I guess all I'm suggesting is that it's useful for the team to be absolutely clear what the purpose of the service actually is, and to make sure that that purpose is very actively marketed to the people that actually make use of you. Now, if you're lucky enough to actually have a home treatment team and they actually have a gatekeeping function, you're very fortunate, because a lot of that assessment will be done off the ward, and of course you've got early discharge as well, which is enormously helpful. But nonetheless, admission tension still exists between home treatment teams and acute wards. So I would say that just having an intensive home treatment team doesn't mean that you shouldn't yourselves be clear on what you're there for.